Hi, my name is Kalea Ward, and I chose my presentation to be focused on the major drug class of antibiotics. Now, for the primary therapeutic use of antibiotics is to treat bacterial infections by either killing bacteria or preventing their growth. Antibiotics help the body's immune system fight infections more effectively and can reduce the risk of complications caused by harmful bacteria. Now, they are used to treat a variety of bacterial illnesses throughout the body. However, antibiotics are not effective against viral infections such as the common cold or influenza because viruses just do not respond to these medications. Now, I chose two key prototypes, the first being amoxicillin, which is a penicillin antibiotic that works by preventing bacteria from forming a strong cell wall. It binds to proteins called penicillin binding proteins, which are responsible for helping bacteria build and maintain their cell walls. By blocking these proteins, amoxicillin weakens the bacterial cell wall, causing the bacteria to break down and die. The pharmacological principle behind amoxicillin is that selective toxicity, meaning it targets bacterial structures that are not found in human cells, allowing it to destroy bacteria while minimizing harm to the patient. Now, the second being cephalexin, also known as Keflex, is a cephalosporin antibiotic that works in a similar way by preventing bacterial cell wall formation. It binds to penicillin binding proteins, which blocks the final steps needed for bacteria to create and maintain their protective cell wall. Now, this weakens the bacteria and causes cell death. Like amoxicillin, cephalexin works through selective toxicity by targeting bacterial cell structures that human cells do not have, making it effective against bacterial infections while limiting effects on human cells. Now, the primary indication for antibiotics is the treatment of bacterial infections. They are commonly prescribed for conditions such as respiratory infections, urinary tract infections, skin infections, ear infections, and dental infections. While antibiotics are primarily approved for treating specific bacterial infections, some may also be used off-label in certain situations. For example, certain antibiotics may be given before dental procedures to help prevent infections in high-risk patients. They may also be used to treat infections when testing shows that the bacteria are susceptible to that antibiotic. Off-label use just depends on the patient's condition and overall the healthcare provider's clinical judgment. Now, the three most common adverse effects of antibiotics, such as amoxicillin and cephalexin, include nausea, diarrhea, and allergic reactions. Nausea can occur because antibiotics may irritate the gastrointestinal tract. Diarrhea occurs because antibiotics can disrupt the normal bacteria in the gut while targeting harmful bacteria. And allergic reactions such as rash, itching, or swelling occur when the immune system responds to the medication. Because amoxicillin and cephalexin are beta-lactam antibiotics, patients with a history of penicillin or cephalosporin allergies may be at higher risk for these reactions. Now, some contraindications for antibiotics, they depend on the specific medication, but one of the most important concerns is a history of severe allergic reactions, such as anaphylaxis. Now, some antibiotics may also require caution or dose adjustments in patients with kidney or liver impairment because these organs are involved in processing and removing medications from the body. Antibiotics should not be used for viral infections because they only work against bacterial infections. Now, a significant drug interaction with some antibiotics is with warfarin, a medication used to prevent blood clots, which I have provided a picture on the screen for you to see. And certain antibiotics can increase the effects of this warfarin, which may rise the risk of bleeding. Patients taking both medications may need closer monitoring of INR levels to ensure their blood remains within a safe range. Now, patients taking antibiotics should be monitored for signs that the infection is improving, such as changes in temperature and white blood cell count. Kidney function should also be monitored because some antibiotics are cleared through the kidneys and may require dose adjustments. Nurses should also watch for allergic reactions and gastrointestinal problems or symptoms, especially severe diarrhea that could indicate a C. difficile infection. And lastly, the three most important pieces of advice for antibiotics include taking the full course of medication as prescribed, even if the patient begins to feel better. Stopping antibiotics early can allow bacteria to survive and may contribute to antibiotic resistance. Patients should also report signs of an allergic reaction such as rash, swelling, or difficulty breathing immediately. And finally, patients should take the medication exactly as prescribed and directed, including allowing timing instructions to ensure that antibiotic works effectively.